Hello, my name is Dr. Rodriguez, and this is one of the treatments for my trigeminal neuralgia. I was pilling with the needles. For some reason, this tissue, I can't release it, meaning I can't get it to return back to normal without the pain and shocks. But on any account, this is the treatment. And it's the treatment that apparently I'll have to do periodically for the rest of my life. But that's okay. I got the needles. And this is the treatment. The key component to the treatment. There's 27 components to this. Without this, it's impossible. Without the needles, it's impossible. Sometimes I use hypodermic needles in here. Without both of those, it's literally impossible to restore this tissue back to normal. But on any account, and sometimes I'll put the needles in and feel nothing. Other times, I'll put it in and it's miserable, like right now. Like that is miserable. I can push it further, but it hurts. And it causes the shock. But I'm not certain whether it's just lighting up because it does it randomly or whether I can actually ignite it, like turning it on like a switch. If you can turn it on and off like a switch, that's closer to the solution. That's closer to the recovery. But if you can't, it doesn't matter. This is the treatment. You have to continuously do the treatment until it's gone, until you're gone. That means forever. It's actually like a cancer. And you treat cancer until the end. Until the end. It's inhumane to stop a cancer treatment when it's helping. It's unconscionable to stop pneumonia treatment when it's helping. It's gruesome to allow someone to suffer with appendicitis without removing the appendix, assuming that it's going to go away all by itself. That's impossible. You have to help it. This is the help. This is the treatment. This is the appropriate treatment. I just happen to be unfortunate. And the tissue has devolved to the point where it's alien. It's cancer-like cells. It is a cancer. And it has eaten into the tissue, the fascia, the fascial planes. Why? It just did. Why me? So that I could figure this out. To discover that I can't figure it out. Because we can't figure out nature. We have to obey. And this is me being obedient to the treatment. But one of the needles did something curious. I'm trying to relax my brow. And they call this stimulating. I tend not to like it. I like more this. You can see it getting stuck. And I'm sliding back out. And I can feel that it's about a level 3 discomfort. And I can't get it in. It just won't go. So maybe later on today or tomorrow I might use a hypodermic needle. And that sends sensations this way and it makes it itchy. So you have to rub the itch out. But let's see here. Which one? It was making a twitch that goes across here. And if you look at Janet Travell's myofascial radiating points. That's how they go. They go across here or up this way. And this is how she discovered it. This is critical. Whatever we discover is already there, and it's only a fractal of what's actually going on there. We can experience it, write it down, but it's not true. Whatever's happening is the truth. The patient directs all the therapy. The provider is just a servant, basically. So that's uncomfortable. And sometimes I do this and don't feel anything, and all of a sudden it just grows back. That's because it's at the molecular level. At the molecular level, you have no control except to apply the therapy continuously until the end. If you stop, that's pretty sad. I can use some other words, but that's pretty sad to stop therapy on someone when it's working. Oh, by the way, this works all the time. All the time. 100% of the time. You just have to apply enough and masterful. Enough, honorable, masterful, and it works all the time. If you use one needle, that's dishonorable. How do I know? I did. One needle, thinking that it would all be, just go away. That's magical thinking. On any account, let me see if I can get it to twitch again. Nope, no twitchy. But on any account, I'll leave these in and play with them throughout the day. Oh, by the way, the idea of leaving a needle in a point and assuming that everything is going to happen is magical thinking. I'll be back. You can ask questions if you like. If you like.